Hi everybody, we are here in Retina Mentors. Today we're gonna talk about patient position. That is something really important, and in our first surgery it could be our best friend or a nightmare. Okay, we're gonna talk about a normal vitrectomy, a normal retina surgery. This is the idea of the patient position. The patient needs to be parallel to the floor so we can have a comfortable position. We are going to talk about in another module about ergonomics of the surgeon, but it's really important that the patient is comfortable. Ask the patient before the surgery if he feels good, if nothing is harming his head, so he's not going to move during the surgery. Alright? I will talk about some disease where the patient position plays an important role during the surgery. For example, with a retina detachment with inferior tears, it's really important that we have at least our patient in this position, because if the neck of the patient is with hyperextension here, and if we have inferior tears, so look my hand position. If the head of the patient it's in hyperextension, for me it will be really difficult to achieve the treatment of the inferior lesions. Okay, I must be like that. So it's really important that you see the case and that you draw a diagram before the retina detachment surgery so you can plan the position of the patient. Okay, other example of this, if the patient has superior tears or superior lesions and the patient is with hyperflexion of the neck, look, it's really hard to me to achieve the treatment of the superior lesions. So it's important that you plan your surgery and you at least have your patient in this position. You can play also the position of the neck to your favor. If the patient has superior lesion, you can hyperextend a little bit, or if the lesion is kind of in the superior nasal quadrant, you can put your patient a little bit to the left side of the contralateral line, so you can achieve a better visualization and a good treatment of that lesions. Also, it's really important that before the surgery you ask the patients of neck problems. So some patients need to have something behind the head to be comfortable and avoid moving during the surgery. This is the first thing that we need to think, the personalized treatment of each surgery. Okay? Another thing that it's important to you to see before the surgery, it's the nose of the patient and the eyebrow arc in the superior part, because patients with atrophy of the orbital tissues will have an eye like if you were doing surgery into a bottle. So it's really important that in those cases you plan really well the patient's position, also the side where you're going to put your trocars, and even with the anesthetic block, you can put a little bit more of liquid behind the eye so you can have a better position of the eye for the surgery.